Hi, my name is Alison-Montagna, and this is my innovation for reducing surgical site infections. Did you know that one readmission for a surgical site infection can cost the hospital around $29,000? That number is staggering, and something else needs to be done when patients are discharged to prevent them from coming back with infections. For those who have recently had surgery, listen up to these innovations. What about a phone application that hasn't been created before, makes it convenient for you and your surgeon to monitor your incision healing progression? Or a take-home kit with all the essentials needed to properly take care of your incision at home, rehab, or a nursing home? Or what about a combination of both? Take a listen to this new innovative ways of how to prevent a surgical site infection. A bag will be provided for the patient to take home or wherever they're discharged to that contains dressing supplies. There will be 1 to 2 weeks of proper supplies for taking care of their incision. The bag will contain unscented antimicrobial soap, gloves, tape, gauze, thermometer for checking for fever, as well as pictures of a healing incision and a couple that have become infected. Hopefully after 1 to 2 weeks, the patient should be on the verge of healing and will have their sutures or staples removed, so dressing changes will be unnecessary. There will also be a phone application for the patient that would utilize the camera feature. It will be free for those who have had an operation performed. The application utilizes a camera that takes a picture of your incision. It is the patient's responsibility to take a picture every day. The picture then gets downloaded automatically to their surgeon's office, which is set up when the application is first downloaded. The surgeon, physician's assistant, nurse practitioner, or nurse can monitor the day-by-day pictures and can notify the patient if the incision is starting to look infected and have them come into the office. The reason that a physician's assistant, nurse practitioner, or nurse can monitor the incisions as well is because we all know how busy surgeons can be. The application will also send the patient a push notification when the dressing needs to be changed. However often the surgeon will tell the patient, usually daily, and it will come with step-by-step instructions utilizing the bag of dressing supplies that will be sent along with the patient. The patient must physically check off a box, which would also be sent to the surgeon, notifying them that yes, this patient has been changing their dressing, along with their incision picture. Here are 3 pictures of incisions. One is a healing incision. As you can see, there's no redness, no drainage, no swelling noted. But the other 2 incisions appear infected. The one on the right has some redness around the incision, and then the one on the bottom appears as if the incision is coming apart. We call that dehissing, and it has some drainage as well. Here is the step-by-step process that will be provided for the patient and their phone application. First, they will wash their hands with soap and water, then put on a pair of gloves, take off the old dressing, and take a picture of the incision to observe for any signs of infections, such as redness, swelling, drainage. If they notice any of the signs of infections, they can use a thermometer to check their temperature. Then they take off the dirty gloves and wash their hands again. They clean the incision with soap and water using 3 pieces of gauze, 1 for each side of the incision and 1 for the middle. After they dry the incision, they're going to use a piece of dry gauze to cover the incision and use tape to secure it. Then they will complete the items listed on their phone application. I knew that I wanted to utilize a camera somehow in my idea. Initially I thought about having the patient take a camera home that the surgeon's office would provide, but then I realized that all of the cameras could be expensive to purchase and may not be returned or may be damaged when done so. Almost everyone has a smartphone today, so I thought an application would be very convenient for the patient. I knew education was also an issue with patients about their incision care. Then I realized that all the patients may not have the supplies needed at home or were too lazy to go to the store to get them. So they would use like Bath and Body Works soap, or they would have their dogs lick and clean their incisions. So I used a combination of all of my ideas, mainly the more detailed phone application and the dressing supply bag. I initially just wanted to do the phone application, but then I got feedback from some peers, mainly Stephanie, saying that the dressing supply bag might be a little more easier to complete. My professor said that all three were good ideas, so I used them all. Stephanie also provided me with feedback for including some the pictures that will be provided in the dressing supply bag, and also with the idea of not only just having the surgeons look at the pictures, but also have other qualified individuals look at the pictures as well. It's funny because after I submitted my 3 brainstorm ideas to the discussion board, the next day at work there was a bag of dressing supplies for the patient to take home along with infection questions provided by nurses in the nurse residency program at Lancaster General. The bag that I came up with, however, is a little bit different and a little more detailed for the patient with step-by-step instructions. The framework of innovation fits with my proposal by firstly reducing costs. Yes, it does cost money to put the bags together, but in the long run, more and more patients can take care of their incisions at home without coming back to the hospital. That will save the hospital around $29,000 per infection and will also save the patient money from all the costs that go along with being admitted to the hospital. Secondly, it provides the patient with access for controlling their health care in some ways. It provides them with the autonomy for taking care of their own surgical site incision, and the quality of their dressing changes and care would be evident to whoever reviews their pictures every day. My proposal also gives the patient easy access by providing them with the supplies necessary and also by using a simple phone application to get the job done. What would be needed to make my idea a reality is many things would need to be bought in bulk, like everything for the dressing supply bag, such as gauze, unscented antimicrobial soaps, gloves, tape, thermometers, and brown paper bags. A group of volunteers would be needed to put the bags together, and I would need to hire someone to help create a phone application because I don't even know the first things about doing so. Yes, this proposal would take some time and money, but think about the lives that it could change and the money that it could save the hospital and the patients in the long run. Thank you.